Greetings, everyone. Did you know that 90% of senior dogs show signs of chronic inflammation, but only 15% of owners recognize the early warning signs? Inflammation is the silent enemy linking many pet health problems that seem unrelated. It contributes to arthritis, kidney disease, allergies, GI issues, and even cognitive decline. Learn how to spot the subtle signs and symptoms, which dietary changes can make the biggest difference at any age. Welcome to PAWS, Reflect, and Heal. I'm Dr. Randy, and today I'm joined by Heather Enajibi from Feline Natural. In this episode, we're going to talk about how inflammation affects our pets in ways most owners never realize. I mentioned dogs a minute, but do you know that 75% of cats over age 10 develop inflammatory conditions? As I've said many times on this podcast, many common pet behaviors we discuss as normal aging are actually red flags, and inflammation could be at the root of today's pets' problems. Today, we're going to have a big discussion about how diet plays a bigger role than most people think in either fighting or fueling the often silent problem of inflammation, and we'll look at other lifestyle factors as well. I'm very fortunate to be joined by Heather Enajibi. Heather is a lifelong animal advocate who began her journey operating an animal rescue and discovering the power of nutrition through her own heart dog's severe allergies. With over a decade in the pet nutrition industry, she works for Canine and Feline Natural, a New Zealand company known for its commitment to sustainability and animal welfare. Heather's mission is to help pets through species-appropriated food and informed choices, building strong relationships with both retailers and pet parents. Heather, before we get started, is there anything else you'd like to share with our listeners about your background?
Yeah, well, I was really fortunate enough to kind of land with this great company and work with Dr. Mark Roberts, who has his PhD in animal sciences. And what I learned from him was if all disease stems from inflammation and an unhealthy gut, let's bring food into this to bring inflammation down and treat gut health. And that's been a really big passion of mine since I've lost one dog to Cushing's. And as we're going to talk about today, I accidentally brought another Cushing's dog into my life a couple months ago. And I'm regaining my passion into this industry by watching it change a dog so quickly. So can't wait to talk to you about Sweet Rose.
We're excited. And, the universe does work in strange ways, I must say. So usually if we don't get it right the first time,
yes.
sometimes it can really help us work it out the second.
Yeah.
But, your pet's itching may not be just allergies. It could be inflammation, silently wreaking havoc. We're going to define what inflammation symptoms might look like, and then we'll talk about some of the things. So Heather, tell us basically your thoughts on inflammation in dogs and or cats.
Well, I mean, we see it everywhere. And I think, as you mentioned, so many things that we do attribute to either just aging or allergies or, this really all comes down to inflammation and an unhealthy gut. So, I mean, I think so many of the problems that people bring their pets into the vet for they really just come down to inflammation, and what can we do as advocates for our pets to reduce it? It's so many things. It's as when I even hear people say my dog stinks, I'm like, why does your dog stink? I'm like, my dog's one of my dogs currently stinks a little bit, but yeah. she's not going to by next month. So, I haven't bathed my other dog in so long because he doesn't need it, and I think people we think about things like arthritis or itchy, scaly skin, but there's just so much that inflammation causes, even behaviors,
And just things that I tell people are kind of red flags are things like licking paws, allergies, fatigue, stiffness after naps, picky eating. These can all be signs. And classic inflammation that goes on for years is called chronic inflammation. And this is where we really get into trouble with some of our pets. Unchecked, we see things like Cushing's disease that you mentioned, kidney disease, even small bowel lymphoma in our cats that is on an incredible rise. So I think that, we want to make sure that we know could pick these things up before things happen. And obviously, early detection can prevent 60% of some of these chronic conditions caused by inflammations. So we'll talk about that, but let's talk about the diet trap, because I know this is right up your alley. I want our listeners to know that Canine and Feline Natural is an amazing company, and they've made incredible strides to help us with this problem. And anytime a company aligns themselves to do that, obviously I'm totally on board. So talk a little bit about the food situation, if you could.
Yeah. I mean, so my beliefs and what I have seen work throughout my career here, but also specifically in the last couple of months, is feeding a diet that is 100% pasture-raised meats. We've got green-lip mussels in all of our formulas. Usually you see that in a joint supplement aisle. We're putting it right into our food. So again, omega-3s, you're changing the balance there. You're, and really the pasture-raised meats is a big, big thing that people don't think about. You don't think about the cortisol levels in a factory-raised meat. They don't think about, and really just the animal welfare aspect of it. New Zealand has done an amazing job in the way they farm, which we get to reap the benefits here by feeding the food. And yeah, just a high meat diet, because biologically appropriate diet is what an animal would, it's what they're meant to eat. We've commercialized pet food and taken them really far outside what they would self-select.
Yes.
And, studies show if you allow an animal to self-select their diet, they're going to select a diet high in protein, high in fat, extraordinarily low in carbs. So I do tend to look at carbs as kind of like, reduce that carb level. Yes, our food can help heal your pet, but keep them out of there in the first place. You can keep them healthy by starting this diet early instead of, like I'm doing now, correcting a lifetime of most likely inflammation her entire life. So.
Yep. And when I work with my pet parents, we set that stage early in a puppy and kitten's life on what that looks like. But let me just back up and tell our listeners kind of a really small, short history. When I was a young guy, which was before the light bulb was invented, we didn't have kibble. So the ranch dogs and the farm dogs ate what we ate. And they ate very biologically appropriate, high protein type diets that Heather's alluded to. Kibble came along because it was, easy. And so now we have these super heat treated, highly processed diets producing things like advanced glycolation end products, Maillard reaction products that are toxic to our cats and dogs. And besides that, they use the simple carbs like soy, corn, wheat, rice, and white potato. And these turn to sugar, which are incredibly inflammatory for our pets. So, often when I have a second and third opinion in hospital or on my telemedicine cases, we immediately work to get those carbs, the simple carbs, out of a pet's diet. We immediately work to get the carbohydrate level down, because even on some of the really good kibbles, there's still 40 or 50% carbs. And as Heather alluded to, these can really cause a lot of inflammatory problems that we're seeing. And that, that doesn't even talk about rendered fats or other types, plant or proteins that can trigger immune systems.
4D meats.
Yeah, exactly. I tell the story, and people probably don't want to hear this, but when I was my first year of veterinary school, we went to a meat processing plant, and we saw what the big food companies were taking as far as their protein. And honestly, it was stuff off the floor. It was tumors. It was animals that were euthanized with euthanasia solution in them. So, these are the things that really could be a problem, to say the least.
Well, and I always think, we all know what a human, like a hot dog you get at the ballpark. You know what part of the meat that is. Well, cheap pet food is what's left after the hot dogs are taken. So that's really, really bad.
Exactly.
Yeah. So the quality and sourcing matter a lot.
Oh, no question. And so, what I tell my listeners is I make a slow transition off of the products that they're on. I'm not a fan of many of the prescription diets. And the reason I'm not is because of the same thing that Heather and I am talking about, that many of these are made with simple carbs. They're highly processed. And, often what you'll find in the allergy dog, let's say, or the GI dog is what we call elimination diet. So the veterinarian's going to try this diet. And many times they go to lamb and rice, which is really a bad choice because in Chinese medicine, the three meats that we stay away from also in inflammation are lamb, venison, and chicken. So, and then these diets are made with the simple carbs and like rice, which basically is inflammatory. So I really like to use testing to help me get to where I'm going to and end up on a company like Canine or Feline Natural. The testing that I do is either a food sensitivity test like Nutriscan or a food allergy test like VDI. And then I also use biome, which a lot of people don't know a lot about, but this is the biggest catchword in human medicine right now. And once we discover how your dog or cat's biome is off, we can correct just with supplements. And as you heard me say, no medicine, we're talking about supplements. So between that and diet, we could really make a big difference.
Absolutely. Yeah.
So, also you've had this experience. We've talked about Rose and we've talked about your other dog. There's a real catch with, like using things like steroids. They may stop the itching, but what's the cost? And, the standard outline for these kind of animals many times is a very strong antibiotic, something like metronidazole, which, as I tell people, is so damaging to our pets. Metronidazole was created by human surgeons so that if they got into your bowel into surgery and leaked something, you'd have no bacteria to leak because it wipes out everything.
Yeah.
And so, this plus the anti-inflammatories, the steroids, the Apoquels, the atopicas, which are immune lowering or, immune suppressing, can really cause problems. And as we can talk about, the vet bills can be quite outrageous.
Yeah.
So I think since we've talked about this, let's talk about your cushingoid experience.
Yeah.
And we'll talk about, maybe Rose and how she presented and then how she looked after you tried your routine.
Yeah. So, and actually that's the slides that we'll be showing here. One of them talks about, because part of the traditional treatment for Cushing's was putting her on Hill's KD, lamb specifically, and the cost of that, if you've looked at the ingredient panel and you put it up against a canine natural or feline natural ingredient panel, they read very, very differently. But what really surprised me was the Hills cost almost the same as our 94% meat, no corn, soy, wheat, fillers diet. It blew my mind because I know what was in that can and that kibble. Why did it cost? Why is it going to cost $300, $400 a month to feed her that? So that was a big part of it. But with Rose, I took her in 14 years old. I actually thought she was going to be a hospice foster. I was just going to give her a comfortable place for a couple weeks. Did the blood test. Everything started steering towards Cushing's, and about 12, 13 years ago, I lost Nina to Cushing's, and I did all the traditional stuff. I would have done anything for Nina. And so I followed all the vet advice, did all the things, and all I did was sort of prolong her life, probably another 8 months, and she was pretty miserable because those medicines were apparently quite toxic because she was not doing well. And so I decided, well, I've got kind of nothing to lose with Rose here. So let me put my money where my mouth is and do the anti-inflammatory diet that I talk about. I did not expect it to turn around as fast as it did.
Sure.
And you'll see in the after picture, within 23 days.
Pretty amazing.
I was hoping for 90, honestly. Yeah. I love our food and I sell our food, but I did not believe that it could do that in 23 days. But I've got the metadata on those photos so I can prove it.
I love it. Yeah, you don't have to prove it to me because I've seen the same thing. And so I just want to back up and let our listeners know about Cushing's. So Cushing's disease is an overactive adrenal gland. It's production of too much cortisol and steroid that's affecting the animal. Often comes with symptoms of drinking a lot of water, urinating a lot, always being hungry. But not really gaining weight. restlessness, pot belly, intense breathing, or a lot of panting and whatnot. So these are often some warning signs, and often your veterinarian could pick up the telltale signs of Cushing's. There are some specific tests that we do to really nail it down, because there are two types of Cushing's, one coming from the pituitary gland and one also coming from adrenal tumor, which is a little bit more difficult to deal with. But Heather did absolutely the right things. And in my world, I would have added, because I have this ammunition, I would have added the food sensitivity or allergy test. I would have added the biome to balance their body to help. But the diet plus the Chinese herbal medicine for marbles is a great way to go. And you can see the results. And obviously we're talking about these medications that are immune suppressive. So here in Arizona, just for example, and really across the United States, there are many fungal diseases that live in the soil. Here we have a fungal disease called coccidiomycosis or valley fever. And when you start putting an animal on immune suppressive drugs like Atopica or Apoquel, cyclosporin, or some of the steroids, you're lowering the immune system, and guess what happens? We may get the signs to improve, but now we have a valley fever dog. And I've seen it time and time again here. And so I really, really caution people to really take a good look and listen to the podcasts like this to make sure you really understand what's going on and what we might be able to do.
Right. Yeah. And I think what you'd find is what I found with Rose's case is it's $300 less a month to do this holistically.
Right.
So I think so often people associate holistic or high quality feeding with big expense, but I think you really need to look at the bigger picture on fluids, antibiotics, kind of this whole kind of wheel you get into of chasing side effects and how much more affordable it is to actually do it. And just seeing Rose run, because she's not so stiff. We talked about other symptoms of inflammation, stiffness, and you think about that with yourself. You hear people say all the time, oh, I had too much pasta or something like that and my joints hurt. Well, what is a 50+% terrible quality kibble going to do to those same joints for your pet? And they live such short lives. Like,
Correct.
Let's throw everything good at them in their short little lives so we have them with us for longer.
Yeah. I just want to mention, if we could, to make sure if you're watching this episode and you like it, subscribe to the YouTube channel that it's on. Look at Spotify and Apple. You'll see these podcasts on there. And also follow us at Dr. Randy Pet Vet, because many of these podcasts will be on there, plus articles and whatnot. A lot of information that I give my clients that will really educate our pet parents, because Heather's job, just like mine, is to educate you and make sure that the more information you have, the better off your pet's going to be. So talk a little bit about, I want to mention Feline Natural, because I'm really interested. I'm interested in both products, obviously, but talk a little bit about how that maybe had come about and what forms it's in, so people can listen, because I really want them to know what the options are.
Yeah. And our feline is truly exceptional, because your cat is an obligate carnivore. So why are you going to pay for a lot of fruits and vegetables that your cat does not need? So our feline diets are 98% meat plus the green lip mussels. Something else we do when I talk about anti-inflammation, our cans and pouches, we don't add any gelling agents, because that's something else that it can upset the GI tract. We just add water and cook it. So you're keeping it very clean. You're not upsetting kind of the balance, but very, very high meat, very high quality meat and green lip mussels. And it comes in freeze-dried pouches and cans. We get a lot of great feedback on our freeze-dried. There is a perception out there that cats don't like freeze-dried food, and I think a lot of times it has to do with the format.
Right.
And we have a great little pellet that gives the cat the mouthfeel. So I really encourage people to try it, because I think they'll be surprised. Even if it's just a treat for their cat, it's a great way to boost the nutrition on top of whatever else you might be doing. And the cans and pouches for diabetes. We have less than 1% carbs in our feline diets.
And that's amazing. I mean, just that level versus if we talk about 40 to 50% simple carbs in many of the kibble type diets. I don't have any of my cats that I'm working with on kibbles unless I really have to. There's some cats that we just have to offer some crunchies occasionally, but I try to avoid that at all costs. But I also like the freeze-dried products because you're adding water, and we need our cats to be drinking. We talk about using multiple fountains in the house with purified water, so the cat really has access to a lot of water, because chronic kidney disease in cats is a terrible problem. And again, another inflammatory problem. And again, we're working on things that we want to be proactive, and Heather and I are educating you guys that we want to do these things so that we don't see you for these issues. I always tell my pet parents, I like to talk myself out of business. I also mentioned I'm not a chiropractor, don't want to see them every week. But I think the more that we can do this, the better off we are, and the better off we can be. So, I think just kind of getting through the misconceptions. There's a statistic out there that if you do some simple diet switches, you can get 40% of the inflammatory markers out of your animal's pet in about 30 days. Now, I tell people, when I try to do these things, like Heather said earlier with Rose, I expect 90 days, 6 months. So I tell people many times it's a slow process, but often we see the changes very quickly. And adding things like omega-3s into your pet's diet, looking at also some really, really good probiotics, goat kefir, let's say, or sauerkraut. There are some great natural things that we can do to balance your pet's body. And we see this through the biome testing. Often that's something that we can correct just with some routine over-the-counter type products.
And then, I'm glad you mentioned the kefir, because that's also part of Rose's diet. Is 25% of her caloric needs are coming from that. I've been consulting a lot with Chelsea Kent from Solutions Pet Products and Dr. Roxanne Stone. So that's part of what we're doing with her, as well as a fish gelatin called Fish Jiggles. Omega-3s. But you'll see that on the chart, that exactly her diet and what it costs to do to turn it around.
And it was remarkable. Good.
And I would like to say, though, because you did mention, I expected 90 days. I think a lot of people give up because of the detox. They mistake what's the detox. They mistake that for the dog getting worse or the cat getting worse, when really it's detox. Because as great as Rose looks now, she still has dandruff. She still has some smell. She's detoxing. 14 years of whatever happened to her, know, and so I always want to encourage people, don't give up. I mean, I feel like Rose was an exceptional case, unexpected, but I think 90 days makes sense, maybe even 6 months, depending on how many years of they've got to shed all of this and get rid of all of those toxins. So I always want to encourage people, do not give up. If things look a little worse that first couple weeks, that's fine. It's fine.
Yeah, and we really get scientific evidence when we run our biome testing with this, and we'll see the high levels of, let's say, streptococcus in their stool, or C. diff or C. perf in there, which can really cause issues. And as Heather is mentioning, the smell often comes from Malassezia yeast or staph bacteria. Again, very often an imbalance in the bowel situation, and many times changing or helping the biome improve really makes a huge difference, and getting a lot of that out of their body. But you're absolutely right. I've had multiple times when I've talked to my owners, my pet parents, about doing these types of things, and they call me in a week and say, God, doc, she's so much worse. And I go, remember that, like Heather said, this has been 14 years of inappropriate diet and the wrong type of situations and the chronic inflammation and the dysbiosis. We've got to correct, and it's got to come out. It's got to come out somewhere. It either comes out in them ear infections or pododermatitis, licking of their feet, and foot infections, or severe skin problems. Right. But it will correct. You just have to hang in there. And sometimes it's, like you said, it sometimes can be tough getting people to walk them through that first, let's say 2 to 4 weeks sometimes can be really difficult.
if your entire diet was McDonald's and then you go with a really healthy whole food diet, you're not going to feel great in that interim while your body figures it out. I love that Rose was Anomaly, but I just don't. I want people to stick with it because, I mean, it will work. Absolutely.
Yeah. Do you feel like there's anything we missed? I know we were talking about our best treatment is prevention, and prevention starts in the food bowl, which I think we've really made that point. Anything you think we could add to this before we're done talking?
Yeah. I mean, I also want to just also talk. I mean, obviously, I sell a brand, but there are so many things you can do. Adding, blueberries, kale, papaya, alfalfa. There's so many things that you can add from your own fridge. Sardines. There's so much you can do on top of whatever else you're doing just to boost. The studies are showing even just 20% of whole foods on top of kibble make all of these changes. Obviously, I want you to bring those carbs way down, but I don't want people to get discouraged by thinking, the store I go to doesn't carry you or things like that. There are other things you can do that you just have in your own fridge or your own pantry that might help.
And I'm assuming this is correct, but I would imagine isn't Canine and Feline Natural available on some online stores like Chewy and stuff like that?
Yeah, and we sell direct. I really encourage people to go into your independent pet store because we really want to support those brick and mortars. But we'll come to you wherever you're at. And I think we've even got something that's coming at the end of this that, a discount code to our own website. But please, go. I know you've got a great store near you, Dr. Randy.
Yes.
So we're reaching out to them now. So
good. Yeah. OK Feed, which has been my mainstay, is about a mile from PAWS Veterinary Center here in Tucson. And I'm always going in there, looking at what they're doing and talking to Michelle and the other people there and saying, hey, we need to be doing a lot more with this Feline Natural product. I'm going to be sending you people. And she always listens to me because she knows I send them. Sure. And ends up a lot of that food walks out the door. So it's great. And I'm using it and I'm enjoying it, and my cats love it. My two Devon Rexes are having a great time.
Well, talk about our palatability then. We win.
Yeah, there you go. Absolutely.
Because all of this doesn't matter if your cat won't eat it or your dog won't eat it. Exactly. I mean, that's another whole big thing. You're absolutely right. It's absolutely right. And I also mentioned, we talked about other additives, but, even on the supplements like omega-3s, people mistake pure fish oil for that omega-3 6 product, and omega-9s can be very inflammatory for our cats. So you have to watch that. I also tell people I really like to have my omega-3s in a gel cap because in a bottle, as soon as you pump or open the bottle, oxygen enters, and the cat has to form these free radicals to scavenger that oxidative oil. So it's always a little bit safer and fresher if you could do it that way. Stinkier because many times you have to pinprick the capsule, and people don't always like that. But it does work really well. And the good news is most cats love fish, so it works out that it works really, really well. Very small price to pay for everything they bring to our lives, right?
Absolutely.
Yeah.
Heather, I can't thank you enough, and I want to tell our listeners again, go on Instagram and follow us at Dr. Randy Pet Vet, or subscribe to the YouTube channel. It really helps us bring people like Heather to you. We're going to be talking about Feline Natural at, I believe, the Cat Writers Association, where I'm going to be doing a keynote. But if you're listening and you have a big organization of cats and dogs that need a speaker, I'd love to come, and I'm sure I could probably get Heather to tag along if we can make that work. So
let's talk food.
There you go. I love it. Heather, thank you so much for being here.
Dr. Randy.
Thanks everybody at your company for allowing this time.
My pleasure.
Look forward to working together in the future.
Absolutely. Yeah,
thanks.
See you soon.
Have a great rest of your day.
Thanks. You too.
Okay.
Bye, everybody.
Bye, everybody.